and I tell you about endocrine system. The first session I tell you about thyroid gland. You must read thyroid gland, adrenal gland, and contrast gland. You must read 3 chapters from only guidance. Your reference is only guidance. You must read good guidance book and good listen me to class, because these slides are very, very important for you. Okay? Thyroid gland related to chapter 20 Swen for Gaiton. 20 Swen from Gaiton book. Okay? Thyroid gland is important gland in our body. This slide shows thyroid gland. Thyroid gland located around trachea and located in the neck. Thyroid gland have 2 lobes, left thyroid gland and right thyroid gland. Every lobe of thyroid gland have many lobules. These are lobules. These are lobules. Some of people have another lobe. This lobe is pyramidal lobe. This lobe is pyramidal lobe. Okay? In this slide, you see about the anterior of thyroid gland. In anterior section of thyroid gland, you see superior thyroid artery and inferior thyroid artery. Superior and inferior thyroid arteries supply thyroid gland. These arterial arteries are very, very important because these arteries supply thyroid gland. Do you understand?
Yes.
Do you understand? This slide is behind of thyroid gland. Behind thyroid gland, there are 4 parathyroid glands. 4 parathyroid glands. About parathyroid glands and parathyroid hormones, Dr. Faqihi told you. Okay? In this slide, you see about the posterior or behind of thyroid gland. In the behind thyroid gland, there are 4 parathyroid glands. Okay? In this slide, you see the nerves that innervate thyroid gland. Thyroid gland is important gland because have many nerves and have a lot of blood flow. Okay? This slide, you see nerve supply. For example, sympathetic nerves and parasympathetic nerves supply thyroid gland. Sympathetic nerves from superior, middle, and inferior cervical ganglia. These fibers supply thyroid gland. Okay? Parasympathetic nerves from vagus and recurrent laryngeal nerves. These nerves related to parasympathetic nerves. Parasympathetic nerves supply thyroid gland. You see recurrent laryngeal nerves. These nerves, the first supply larynx and again come back to the thyroid gland. Therefore, these nerves are recurrent laryngeal nerves. Okay? Do you understand?
Yes.
This slide is before slide. You see this slide, thyroid gland located around neck and flagella. Okay? This slide you see thyroid gland and thyroid hormone and calcitonin. You know thyroid gland secrete thyroid hormones, but thyroid gland secretes calcitonin, but calcitonin is not thyroid hormone. About calcitonin, Dr. Faqihi told you, okay? This slide shows about, this is one follicle. One follicle. For example, there are many follicles located around together and convert to lobule. Many of lobule located to around and convert to lobe. Okay? This is one follicle. These are follicular cells. Okay? These are follicular cells. Follicular cells secrete thyroid hormones. Secrete thyroid hormones. In this slide, you see the microscopic slide for follicular cell. These are follicular cells. Follicular cells secrete thyroid hormones. Okay? Out of follicular cells, there are parafollicular cells. Parafollicular cells release calcitonin. Therefore, calcitonin released from thyroid gland, but is not thyroid hormone. Okay? This slide shows about the origin or compartment of thyroid hormones. I ask you, you have or I have 3 type hormones, okay? Please name 3 type hormones in our body.
Amino acid based hormones and protein and based hormones and lipid based hormones or steroids.
Okay, very good. Protein hormones or peptide hormones, amino acid hormones and steroid hormones. Okay? The most hormones in our body are peptide or protein hormones, similar insulin, glucagon, growth hormone, and etc. Okay? There are 2 type hormones in our body that these hormones are amino acid hormones. Okay? Thyroid hormones are amino acid hormones. Do you know about, please tell me about, there is another hormone, this hormone is amino acid. Do you know?
Cortisol?
No, cortisol is a steroid hormone.
I know I think it's one of the sex hormones, but I'm not sure which.
No. Sex hormones are steroid hormones.
Amino acid.
Is aldosterone?
No, aldosterone is a steroid hormone. Yes, very good, very good. We have epinephrine and norepinephrine in our body, okay? Epinephrine and norepinephrine released from sympathetic neurons. Well, therefore, maybe these material released from the medulla of
Adrenal gland.
adrenal gland. Okay. I will tell you about adrenal gland maybe tomorrow, maybe today. Adrenal gland have two sections, cortex and medulla. Medulla in adrenal gland release norepinephrine and epinephrine. Okay? When norepinephrine and epinephrine release from medulla, these names are hormones. When norepinephrine and epinephrine release from the end neurons, sympathetic neurons, name neurotransmitters. Okay? Therefore, we have two types amino acid hormones in our body: thyroid hormone and norepinephrine and epinephrine that release from the medulla of adrenal section. Medulla section. Okay? This slide shows the origin of thyroid hormones. Thyroid hormones are thyroxine or T4, triiodothyronine or T3, and reverse T3. Reverse T3, T4, T3, and reverse T3. The first approximately maybe 90% of hormones released by T4 form or thyroxine form. Okay? Approximately 5 to 7% of hormone released by T3. Approximately 1 to 3% release reverse T3. Therefore, the most important, the most value of thyroid hormones, the first time release T4. Okay? But T3 is active form of thyroid hormones in our body and in the blood. T4 convert to T3. T3 is active form of thyroid hormones. Okay? You see in this slide two ring of thyroid hormones, A ring and B ring. A ring and B ring. Between A and B ring there is oxygen bond. A ring connects to amino acid of alanine. B ring combine to phenol ions. Okay? T4, A ring and B ring. A ring have two ions, B ring have two ions. T3, A have two ions, but B has one ion. Reverse T3 is reverse of T3. A has one ions, but B ring have two ions. Okay? I repeat for you. T4 and T3 and reverse T3 have two rings, A ring, B ring. Between A ring and B ring there is oxygen bond. A ring combine to amino acid, alanine amino acid. B ring connect to OH or phenol ions. Okay? In the T4 or thyroxine molecule, A ring have two ions, B ring have two ions. T3, A ring have two ions, but B ring has one ion. Reverse T3 is reverse of T3. In the reverse T3, A ring has one ion, B ring have two ions. The important thyroid hormone is T3 because T3 is active form of thyroid hormone. We have in our body, many receptors for T3 because T3 is active form of T4 in the blood and our tissue. T4 converts to T3. Okay, T3 is active form of T4. In this slide, you see follicles, lobes, thyroid. These are follicle or follicular cells. Follicular cells release thyroid hormones. Okay. This slide shows you about the synthesis of thyroid hormone. The synthesis of thyroid hormone. For example, this is follicle cell. This area is blood. This area is lumen of follicle. This slide shows about the phases of synthesis of thyroid hormones. For example, this is follicular cell. This is follicular cell. This area is lumen. This area is blood. Okay? You know, for synthesis of thyroid hormones, we need two iod ions. Okay? Iod ions are very, very important for synthesis of thyroid hormones. I ask you, which of foods have many iod ions?
Especially
Yes. This slide shows this area is blood. Okay? This is one follicular cell. In the cell membrane near the blood, there is iodide porter or iodide transfer. This iodide porter bring negative ion into the cell. Okay? Then thyroglobulin synthesized in the ribosome or endoplasmic reticulum. Okay? Then thyroglobulin combined to iod. Okay? Thyroglobulin combined to neutralize iod ion, no negative iod ion. In the cell membrane near to the lumen, there is important enzyme. This enzyme is tyrosine peroxidase or tyrosine peroxidase. Tyrosine peroxidase convert negative iod to neutralize iod ion. In the cell membrane and in the lumen, thyroglobulin cook to neutralize iod ion. Okay? You see this slide. Thyroglobulin is a big molecule secreted into the lumen. I ask you, which is the mechanism for secret of thyroglobulin toward lumen? Do you know?
Exercise.
Very good. Very good. This slide shows in this area thyroglobulin by exocytous pathway secret into the lumen. When thyroglobulin bring or come into the lumen, combine to neutralize iod and convert to دارم واژه من بنویسم براتون اگه بنویسه when thyroglobulin convert to neutralize iod convert to DIT and okay MIT. DIT is D-iodotyrosine. iodotyrosine. MIT is mono, iodotyrosine, DIT and MIT. Okay? In this moment, if we need 2T4 or 2,3 or reverse T3, maybe DIT plus DIT and convert to T4. Okay? Maybe we need to T3. Therefore, DIT plus MIT. Okay. Therefore, in the lumen, we have DIT, MIT, T4 and T3, and maybe 1% of reverse to 3. Okay? In this slide, you see thyroglobulin have DIT, MIT, T4, T3, and a few little of reverse T3. This material again come to the cell. I ask you, which of these mechanisms these molecules enter to the cell? Endocytosis. This slide shows you endocytosis. Okay? Therefore, thyroglobulin with MIT, DIT, T4, and T3 enter to the cell. Immediately, proteases in the lysosome activate and hydrolyze thyroglobulin. When thyroglobulin hydrolyzes, convert to tyrosine and iod and globulin. Okay. Tyrosine and globulin again in the endoplasmic reticulum convert together and combine to thyroglobulin. DIT and MIT, T3 and T4 remain into the cell. Okay? DIT and MIT by deionization convert to iod and tyrosine. Iod again synthesize thyroid hormone. Tyrosine again enter to the endoplasmic reticulum. Therefore, T4 and T3 remain into the cell. T4 and T3 are a small molecule. These molecules can secrete into the blood by simple diffusion. When T3 and T4 come to the blood, we name thyroid hormones. Okay? Do you understand? I repeat for you, please do listen to me. This slide is very complex slide. فارسی متوجه بشین بچه ها؟ میدونی؟ Do you know Persian?
Yes.
Do you know Persian? تقریبا. Do you know Persian? حالا اونایی که فارسی میفهمید من بهتون فارسی میدم به بچه ها بگید. اگه یه اسلاید خوب نفهمید من سوال بدم اصلا جواب نمیدید. ولی اگه خوب بفهمید جواب میدید. اوکی؟ حالا به بچه ها توضیح بدیم به انگلیسی بهشون بگیم انگلیسی.
After explain, she will ask you a question, and if you didn't get the question, then you didn't get the
How does deionization happen?
Yes, I repeat for you. For synthesis of thyroid hormones, we need two ion ions. Okay? Ion ions are in the fish and seafood and in the value of salt. Okay? We cook our food with iodid salt. In the cucumber and broccoli, there are a few little of ions. Okay, in this slide you see blood and lumen. This is follicular cell. I told you, follicular cells secrete thyroid hormones. The first type for synthesis of thyroid hormones, we need to iodic porter or iodic transfer. This porter bring or transfer negative ions toward cell. Okay? The second phase, in the endoplasmic reticulum, thyroglobulin synthesized. The third phase, thyroglobulin must combine to ion ions, but thyroglobulin can combine to neutralize ion ions, non-negative ion ions. We need important enzyme in the cell membrane near to the lumen. This enzyme is tyrosine peroxidase. Tyrosine peroxidase convert negative ion to neutralize ion. Therefore, if you look at thyroglobulin in the cell membrane, a lot of thyroglobulin in the lumen combine to neutralize ion. I told you, thyroglobulin is a big molecule by exocytose pathway secrete in the lumen and cook to ion ions. When thyroglobulin cook with ion ions convert to DIT and MIT. DIT is diiodotyrosine. MIT is monoiodotyrosine. If we need T4 and T3 and reverse T3, maybe two DIT molecule combine together and convert to T4. Well, we need two T3, one molecule DIT convert to MIT and convert to T3. Finally, thyroglobulin with DIT, MIT, T4 and T3 again by endocytose pathway enter to the cell. These cells have lysosomes. In the lysosome, there are many proteases. These proteases, thyroglobulin hydrolyze and convert to tyrosine and globulin. Tyrosine and globulin in the endoplasmic reticulum convert together and combine together and convert to thyroglobulin. DIT and MIT by deiodination convert to iod and tyrosine. Again, iod synthesize thyroid hormone, tyrosine come to the endoplasmic reticulum and convert to thyroglobulin. Finally, T4 and T3 remain into the cell. T4 and T3 are very small molecules by simple diffusion secrete into the blood. Okay? For synthesis of thyroid hormones, we need uric protein, we need tyrosine peroxidase, we need deiodinase enzyme, we need lysosome, and very pathway. This slide shows about the receptor of thyroid hormones. You are very clever students, and you know thyroid, the endocrine session need to power biochemistry. Okay? Because these materials I told you are biochemistry, not related to physiology, but you must know the first time biochemistry of hormones and you know physiology of hormones, okay? Maybe Dr. Faki, he told you about we have 3 type receptors for hormones, okay? Cell membrane receptors, cytoplasmic receptors, and nuclear receptors, okay? For example, peptide hormones have cell membrane receptors. Peptide hormones or protein hormones have cell membrane receptors. Steroid hormones have cytoplasmic receptors. But I told you thyroid hormones. Thyroid hormones have nuclear receptors. Okay? T4 and T3 are a small molecule. Bring from cell membrane and enter to the nucleus. In the nucleus, located on the DNA bond. We have important receptors in DNA bond for thyroid hormones. Therefore, thyroid hormones combine to the nuclear receptors. Okay? Then activate RNA polymerase and produce total of new proteins. Therefore, thyroid hormones with nuclear receptors synthesize new proteins. These proteins affect on the growth, central nervous system, cardiovascular, and total body. Therefore, we have receptors in our body for thyroid hormones. Thyroid hormones are very important hormones. We need thyroid hormones in the normal value. When we have hyperthyroidism, or the hyperthyroidism are very harmful for our body. When I am hypothyroidism, in the hypothyroidism, the value of thyroid hormone is very little and damage to our body. Therefore, we need to normal value of thyroid hormones. Hyperthyroidism and hypothyroidism are very harmful and damage to our body. Okay? Thyroid hormones have receptors in total of body. For example, respiratory system, reproductive system, GI system, kidney system, nervous system, bones, and total body. In this slide, you see the control of thyroid hormones. Control of thyroid hormones. This area is thyroid gland. Okay? I told you thyroid gland releases thyroid hormones. There are many cells in the pituitary gland. These cells are named thyrotropic cells. Thyrotropic cells. Thyrotropic cells in the pituitary gland release TSH. TSH is thyroid stimulating hormone. Have many receptors on thyroid gland. Okay? In the hypothalamus, there are many nucleus. These nucleus release thyrotropin releasing hormone. Thyrotropin releasing hormone have receptors on the thyrotropic cells in the hypophyse. Okay? Therefore, TRH stimulates TSH stimulates thyroid gland. Okay? This slide is similar before slide. From hypothalamus release TRH. TRH have receptors on the pituitary gland and activate pituitary gland and release TSH. TSH have many receptors on thyroid follicles. When thyroid follicles activate, release thyroid hormones. I told you we need to normal value of thyroid hormones. When in our body, thyroid hormones are very high level. Again, but negative feedback. Decrease TSH. Also, decrease TRH. When decrease TRH, decrease TSH, decrease thyroid hormones. This slide shows positive and negative feedback control in this slide. Okay? The arrow key of green arrow key shows positive feedback. The red arrow key shows negative feedback. There are these mechanisms in our body in daily. Therefore, you have normal value of thyroid hormones. Okay? This slide is before slide. TRH activate pituitary gland and release TSH. TSH activate thyroid gland and thyroid gland release T4 and T3. Again, by negative feedback, control TRH, TSH, and T4 and T3. Okay? You understand? I ask you, if, for example, I have hypothyroidism, okay, or maybe difficult in thyroid gland, maybe difficult in pituitary gland, maybe difficult in hypothalamus, okay? I ask you, which of these section is complex for treatment? Hypothalamus, hypophyse, or thyroid gland? Hypothalamus. Okay. Maybe I have very high level of T3. Maybe I have very level of TRH or TSH. Okay? I ask you, because you are medical students, I ask you, if, for example, I have many in the laboratory shows I have many level of TRH. Okay? For example, this physician on endocrine physician maybe tell to me I hypothyroidism or hypo, never mind. This physician or endocrine maybe treatment to tell me about a scan of hypothalamus and thyroid gland and hypophyse. Okay? من فارسی میگم شما توضیح بدید چون این قسمت نمیتونم بهتون بفهمونم. میگم اگر من مشکل داشته باشم تو قسمت هیپوفیز و هیپوتالاموس فقط تو آزمایش نشون نمیده، مجبورم اسکن کنم. اسکن کنم از مغز، دکتر تشخیص بده آیا هسته هایی که TRH یا TSH ترشح میکنن بزرگ شده، توموری شده یا نه. ممکن حتی تومور شده باشه. وقتی از معمل جراحی هم دارم. متوجه حالا بچه توضیح بدم. Please explain for your students.
She's saying when you have an issue, for example, if in the hypothalamus or the anterior pituitary, yes, you can't just do a test, a blood test, or you need to do a scan, and from the scan they'll find out your levels of TRH and TSH. Maybe they're too high or maybe they are too low, and from this we can correct the issue.
Surgery. Surgery.
Okay, see the tumor and then correct the issue. I'm sorry.
Okay. Thank you.
Thank you.
The subjects that I told you about are related to biochemistry, anatomy, and histology. Therefore, at now I tell you about the physiology of thyroid hormones. Okay? Thyroid hormones affect on the metabolism rate. Metabolism rate. Thyroid hormones increase metabolism rate and produce energy in our body. Therefore, thyroid hormones help to produce energy in our body and are very, very important hormones. In a normal value, thyroid hormones hydrolyze carbohydrate, hydrolyze lipid, and produce energy. Thyroid hormones in the normal value synthesize of protein and help to growth and puberty. Okay? In this study, you see when thyroid hormone is when there is hypothyroid, basal metabolism rate is very low level. When normal value, basal metabolism rate is normal value. When hyperthyroidism, basal metabolism rate increase and damage to our body. We need to normal basal metabolism rate to normal thyroid hormones value. Okay? In hyperthyroidism, thyroid hormones are high level and hydrolyze lipid and carbohydrate and produce energy. Okay? Thyroid hormones synthesize protein and help to growth and puberty. In this slide, you see about the action of thyroid gland or thyroid hormones on in our body. I tell you about the effect thyroid hormones on brain nervous system on brain. Thyroid hormones have many receptors in the brain and induce brain development. Okay? When one mother has fetus in our uterus, need to thyroid hormones normal value. Okay? If in this time thyroid hormones in its body is very low level, damage to the fetus. When this fetus
Cretinism.
what?
Baby cretinism.
Baby, no,
The baby will be smaller in size and its organs and brain won't be formed much, right?
And he'll also not be mentally.
in this baby, nervous system cannot to develop when thyroid hormone in their mother is very high, low level, damage to the nervous system in the baby. Okay, this baby induce cretinism. Do you know cretinism? What is mental retardation? Okay. This baby induce mental retardation. For example, this baby cannot good growth, cannot good speak, cannot good walk, and cannot good eat, and etc. Because we need to thyroid hormones for development of nervous system. Okay? If one parents notice 1 year old baby, if one parents understand can good treatment, but after 1 year old, for example, baby became 2 years old or 3 years old, unfortunately cannot treatment this baby, and baby induce mental retardation. For example, in the 6 or 7 years of baby, this baby
Cannot speak.
this baby is eating pen, eating eraser, and for example, hand put in the food and yes, through to your face and to your wall, okay? Because this baby has mental retardation. This baby is named cretinism. and unfortunately no treatment for total of life. Okay? Therefore, thyroid hormones are very, very important for brain development. Okay? Thyroid hormones have receptors on the heart. Thyroid hormones have two type effect on the heart, directly and indirectly. Directly, thyroid hormones have receptors in the heart and activate heart and increase contractile
Strength,
and
rate of contraction.
increase rate of heart rate, increase blood flow. Indirectly, thyroid hormones affect on the heart. Do you know which is the mechanism for indirectly effect of thyroid hormones on the heart? Do you know?
The heartbeat slower.
No.
Does it make the heart larger, and that makes the heart, that increases blood flow?
No. I asked you, I told you two type mechanism, directly and indirectly. Directly related to thyroid hormones have receptors on the heart. Okay. Indirectly, thyroid hormones increase contractility and heart rate. I ask you, which is the mechanism for the effect of indirectly
They
thyroid
increase
Blood pressure?
Muscle
they
mass.
increase-
Which?
No,
they
that's
increase
Muscle
calcium,
contraction?
they increase the amount of
Yeah.
calcium available in the extracellular matrix.
exactly.
No.
On the valves.
Related to norepinephrine and epinephrine.
Got
Adrenal
a
cortex.
parasympathetic.
Effect on adrenal cortex.
They make the nerve endings in the heart, they cause them to secrete epinephrine and
No. Thyroid hormones has indirect effect on heart. Thyroid hormones increase or activate receptors related to adrenaline and norepinephrine.
So it
and
makes it more
norepinephrine.
sensitive.
Okay. When increase receptors of norepinephrine activate heart. Okay? Therefore, thyroid hormones have two type effect on the heart, directly and indirectly. In the directly, thyroid hormones have special receptors on the heart and activate heart function. T4 and T3 or thyroid hormones increase and activate norepinephrine and epinephrine receptors in the heart. Again, activate heart. Okay? Thyroid hormones affect on digestive system. When one person has a few little of thyroid hormones, GI session cannot good work. GI session have little absorption, little digestion, little movement, little secretion of waste material. When one person has a high level of thyroid hormones, GI session work very hard and damage to the GI session. Therefore, for GI session, we need to normal value of thyroid hormones. Okay?
Is it related to the temperature of the body? Like the high thyroid hormone control the temperature of the body.
Temperature?
Yeah.
Yes.
So
I told you the thyroid hormones control temperature because increase basal metabolism rate.
Yeah,
Okay?
yeah. I think that's the reason. That's it's a mechanism which indirectly affects on the heart rate.
Yes? Yes?
Make the heart rate weaker. Like so.
If we have normal value of thyroid hormones, it's very good for heart. But we have a very high level of thyroid hormones, contractility activity in heart, very high level, and damage to the heart.
Yeah.
Yes?
Yes.
Maybe induce infection in the heart. Because thyroid hormones very good for normal value for in the normal value for heart. No hyper, no hypo. Hypothyroidism induce weakness in the heart. Okay? For example, heart rate became 30 to 40 per day. Okay? Per minute. But in the hyperthyroidism, maybe heart rate reach to 100 per minute and damage to the heart. Okay? You know, we have heart rate approximately 75 to 80 per minute. When we have normal value of thyroid hormones, we have normal heart rate. Okay? In this slide, you see about thyroid hormone effect on the bone. I ask you, what is the function of thyroid hormones on the bones?
The bones is bone growth.
Increase bone growth.
Growth.
Yeah.
Increase growth bones, especially
Osteoblast.
especially
Long.
long bones.
If it decreases or if it increases?
Increase because thyroid hormones synthesize protein.
Or the
You know the most protein in the bone are collagen. Okay? Therefore, thyroid hormones activate long bone.
Is this hormone also affecting or like secreted like the growth hormone? You know?
For synthesized protein, thyroid hormone act similar growth hormone. Okay.
Yeah.
But for lipid and carbohydrate, not similar growth hormone. For synthesized hormone, okay. Growth hormone and thyroid hormone together synthesize protein, okay, and help to growth. Thyroid hormone effect on the muscles. Because or since thyroid hormone synthesize protein, therefore activate muscle contractions. Okay? This slide shows about another function of thyroid hormones. For example, thyroid hormones effect on the pancreas. You know pancreas, in the pancreas we have beta cells and alpha cells. Beta cell release insulin, alpha cell release glucagon. Therefore, thyroid hormones activate pancreas. Thyroid hormone effect on the muscles and on the liver. In the muscles increase glucose transporter 4 and help to transfer of glucose, increase glucose uptake. In the liver, we have many receptors for thyroid hormones in the liver and increase of PEPCK activity. This is an enzyme, a very important enzyme in the liver. Increase gluconeogenesis, increase glucogenolysis, increase hepatic glucose output. Okay. In another, and then peripheral insulin resistance, induce peripheral insulin resistance, and thyroid hormones effect on the adipose tissue and increase lipolysis. When increase lipolysis, produce energy. Okay, increase serum free fatty acids and produce energy and induce increase basal metabolism rate. Okay. In your, if you read good book, in your book write about the effect of thyroid hormones on the puberty.
Yeah.
Okay?
You.
Yes. In the puberty, thyroid hormones is very important because synthesize protein and increase puberty. If one person has a very low level of thyroid hormone, damage to the reproductive system, if one person has high level of thyroid hormones, again damage to reproductive system. Therefore, in the reproductive system, we have two normal value of thyroid hormones. In your book, you see about thyroid hormones. When thyroid hormones is very, very high level, maybe in one person induce goiter and goiter exophthalmia. In the goiter exophthalmia, the eye bring out of outside. Okay, maybe you see in your book one picture related to one woman. This woman has goiter exophthalmia and damage to the auditory system and damage to the eye. Okay? Maybe the chapter 677 is finished. You can for rest and again come back